Welcome to the Mommy Mentor Podcast. This parenting bullshit is hard, am I right? From sleepless nights with newborns to sleepless nights with teens, from potty training to sending them off to college, I'm here to get you through it all as your mommy mentor. My name is Kennedy-Heldt, and I'm a registered nurse and a mom of 3. I have professional experience with moms and babies as a postpartum nurse, which keeps the postpartum and newborn experience fresh in my mind. And I have 17 years of parenting experience as well. For information on this podcast and more, go to mommymentorpodcast.com. Parents, grab a cup of whatever you prefer and settle in for the next episode. Hello, everyone. We have a very special guest on the Mommy Mentor. So today on the Mommy Mentor, I am thrilled to welcome Dr. Phindile Chowa. And she is a Harvard-trained, board-certified emergency medicine physician, and she is the founder of EM Care to You, a concierge medical practice dedicated to supporting new moms through challenges of the postpartum period. Dr. Chowa is an expert in personalized postpartum care, and she is helping mothers navigate the critical 4th trimester with compassion, holistic support, and advocacy. She is also the author of What to Expect Next, a comprehensive postpartum guide. And she hosts her own podcast, 4th Trimester Voices. And she amplifies the experiences of moms and birth workers on that podcast. Dr. Chowa brings a unique perspective to maternal health and advocating for early screening, proactive support, and individualized care. And I am so excited to dive into this very important conversation with you today, Dr. Chowa.
Thank you for that introduction.
You're welcome. You're welcome. So I understand you created your own business kind of designed to help women in the 4th trimester, and you described your superpower as providing compassionate, personalized care for new mothers in the postpartum period. Can you share some of the specific challenges you see mothers facing during this time and how personalized care can make a difference in their recovery and well-being?
Absolutely. So I think, when moms give birth, they have an idea of how childbirth looks like. They have an idea of how pregnancy looks like. But postpartum is one of those things that it is a different experience for every single person. The aches and the pains, the recovery process. I mean, there's timelines that have been set up just because of, what most women are doing, so most people see their doctor at 6 weeks. They say, after 12 weeks, you should start feeling yourself. There's all these different timelines, but the reality is a lot of women face different challenges. And so they don't go by the book, right? And so for one person may be ready to engage in intercourse at 6 weeks, but somebody may still be struggling with severe pelvic pain, pain around their incision, back pain. And so those timelines don't work for everyone. And so why personalized care works so much for postpartum patients is that you're not looking at the patient from the terms of a book. You're looking at each individual woman and you're saying, let's talk about your issues. And so I would say the biggest challenges that I see that women face are going to be really mental health challenges. A lot of women don't know how to process the emotions that they're going through. They don't know what's normal, what's abnormal. And so the emotional and mental challenges that women go through, I think sometimes they struggle understanding, is this baby blues? Is this normal? Do I have postpartum depression? Do I have postpartum anxiety? How do I process all of these feelings, right? And then, on top of that, there's just like, what is regular healing? When should my back stop hurting? Should my back be hurting? Should my pelvis or my C-section scar be hurting? And so it's just a regular, healing and what is normal. And so a lot of moms just end up being like, well, I have back pain. I just carried a baby. And yeah, eventually it will stop. But like, no, you shouldn't have back pain, right? And I'm leaking and I'm spilling urine. But hey, I just had a baby. But no, you shouldn't be spilling urine. So, so I think a lot of moms just don't know what is normal, what is abnormal, and then just the mental and emotional challenges that they have to go through.
Yes, I definitely relate myself, but also I am a postpartum nurse, so I see it every day. Like,
Uh,
just the other day, one of my patients, her baby had jaundice, had to go under the Billy lights. And that's really hard because they can't be swaddled, so they cry a lot. And I mean, my own son had to do that, and that's not fair. So, it's just not fair. It's not fun. It's not what you want to do. And it's not the worst thing in the world, but it is an emotional roller coaster because now you're going to be there longer and you maybe have another child at home and you miss them. And so as a postpartum nurse, I see these struggles every day, like just the emotional struggles. And what kind of stinks about it is I'm so busy. I don't have always the time to sit with them and like support. But I always, when I discharge people, because there's mental health resources on our discharge packets for like
okay.
everyone,
Good.
it's just printed on there automatically for everyone, no matter who they are. It's just always on the paperwork. But so whenever I talk about that, I'm like, and just if you need a therapist, you could maybe see one virtually, so then you don't have to go out. And
Mm-hmm.
so yeah, I always am encouraging that. But it can be really tough in the postpartum period, the mental health, because especially if you're a new mom and you've not done it before, it's like a big identity change for you. You're a mom now, you know?
Absolutely. And also, if you haven't been a part of like just the mental health world, right? So, like,
Mhm.
I saw my own first therapist postpartum. And before then, I had never seen a therapist before. I didn't
Yeah.
understand the need of one. I didn't think I needed one. And so it took a while to get to the point where it's like, okay, I need help, But I think a lot of moms don't know how to get there, right? And
Right.
if they're not somebody who's familiar, now our generation, they're all about therapy and
Hmm.
getting the help that they need. But I feel like that's really just a new thing and just intensified with COVID.
Right.
But before then, a lot of moms are just struggling at home and just like, oh, it's
Mhm.
normal. I'll get
Mhm.
through.
Yeah, it's more normalized now. Like, the pandemic brought about a lot of mental health issues, so people are talking about mental health a lot more. So I feel like people kind of, virtual therapy commercials and things. So I think it's more widely talked about. People maybe know a little bit more how to access that now. Yeah, I would agree. Like, especially if you don't know what's normal or what's like, is this just, like you said, the baby blues, or do I have an actual problem? And how do I seek a therapist? And, that is, if you haven't done that before, how would you know what you're doing, And that can be a struggle in itself. And you're just like, I already don't know what I'm doing as a mom, and now I have to find it. I think I need help, and I can't figure out how to find help, you
Absolutely.
know? Oh, what a stressful time it is. Yeah. So I totally relate to that. And I think it's wonderful that you provide the individualized care for women. So, and include that mental and emotional support piece too, because it's not just about what your body's doing. What your body is doing is separate, but you also are emotional about what's happening to your body.
Absolutely.
So that there's changes that are just not gonna they're not going to go back. It's
Exactly.
just the way it
Exactly.
is, and you can be emotional about that piece too. And then if you, like you said, are having issues like leaking urine, or your incision is still hurting, or whatever it may be, oh, what another emotional roller coaster. You're not just, hi, I'm physically fine and I'm just dealing with the other things. It's that can add a whole nother layer if there's a physical issue as well.
Absolutely. And then also just needing to leave your house. Like I provide services in
Oh,
homes. And so I
that's
think that also,
wonderful.
yeah, so I think that's really helpful because I think the mental turmoil of getting up to go to an appointment
And
is
packing up your
torture.
baby, oh my
It's
gosh, it takes
torture, right?
forever. Yeah,
Like the diapers, the clothing, making sure you have
I
the food.
know.
Like people don't understand that like every time I have to leave my house with a newborn, it is
It's a whole
anxiety provoking.
project. Yes,
Okay.
it's a whole project, and it's like it's a lot of anxiety, like you have to all the stuff you have to do. It's like the diaper bag and get them ready. And I remember my third child, my son, would every time he would pee on himself in a diaper change right before we had to go somewhere, and I was like,
Oh my gosh.
okay, this isn't fair because now I have to like clean everything up.
Oh my
Yeah.
God.
So it's like that I'm late to the appointment, and it's hard to get anywhere on time. And packing up
Absolutely.
the baby is stressful. They scream while you're putting them in the car seat, it's just, and so it's wonderful that you're coming to parents. And that's why I always am like the virtual therapy, they have that now,
Right.
because then you don't have to do all of that.
Absolutely.
or find a babysitter, too, because like that can be stressful too, is leaving your child like a newborn,
Absolutely.
with someone else, or you could bring them to the therapy appointment, but maybe that doesn't work so well because you can't focus on yourself and the conversation at hand. So that
Absolutely.
is wonderful. Yes, I love home care. I wish there was more of that in the United States and that our insurance benefits cover it
Covered it
better.
right
There's
now.
that piece too, because I know like I was doing care coordination for a while, and some of the people, they're older people that I was working with, but their Medicare wouldn't cover it in some instances, and I'm sitting here going, why? But you'll cover a transitional care unit, which is more expensive. That doesn't even make sense.
Yes, it's going to change soon, with our baby boomers aging out. They're
Hmm.
going to have to get creative with
Right.
care at home. Like right now, I do see other patients, but I don't see the elderly, obviously, because it's Medicare. They're on Medicare, so over
Mhm.
65. And so, but Medicare controls them,
I
like that
know.
they dictate their care. And so,
Mhm.
at some point, it's just going to be, there's going to be too many baby boomers and they're not going to be able to, get the help that they need. And so
Mhm.
telemedicine, in-home visits, mobile units, mobile hospitals, we're
Mhm.
going to see it. We're going to see more of it.
Yeah, I believe it. I believe it. I never thought I'd see robots delivering people's food, but here we
And
are.
medicine.
And
My
I
my
know
friend just told me today there was a robot that came to deliver medications to their office, which is bizarre. I
huh,
was like,
that's weird. I'm sure she was like,
yes. Yes, she was like, they had a name for the robot, and the
how
robot was
funny.
delivering medications.
Weird. Hmm.
Yes,
Hmm.
very.
Interesting. Well, that on to a whole or a different topic, a different question, but related
Mhm.
to maternal health. So, as we know, in the country now, there is a maternal health crisis, and it's especially severe among Black and Brown women. And Black and Brown women, they experience higher rates of complications and mortality, unfortunately. In your work, what systemic changes or approaches do you believe are most necessary to address these disparities and improve maternal outcomes?
Absolutely. So I always divide this, on the individual level, what can we do on the community level, and then the government level. And we know that as you go from the top down, that it's going to be longer. It's a longer play, right? And so in terms of governmental policy changes, this is going to be one of those things that it's just going to be slow and is not going to provide the change that we need, right? On the community level, what I feel that I really try to do well is to get the whole community involved, right? Get all the birth workers together and figure out how can we support our moms. And so, creating birth alliances in each community. So you're having pelvic floor therapists, lactation consultants, doulas, nurses, midwives, obstetricians, everybody getting involved and forming these alliances that are able to keep an eye on mom, right? And so there's that aspect of things, and then there's just the family community, right? Educating the grandma, dad, aunt, anybody who has access to the home, and figuring out how to protect mom and how to keep mom safe. And
Hmm.
then there's the individual level where it's like, how do I educate patients and clients to be able to advocate for themselves, right? Because it's like, this is your body, what's best for your body, and you have to, if something doesn't feel right, you have to speak up. I have these events in Atlanta called Empower Mom, and we bring together, tons of pregnant moms, and we have a panel discussion. We have different birth workers who come on and they give mom advice, and moms are able to ask questions. And one lady was saying she was really terrified of asking her doctor this question because this was the doctor that Medicaid had given her, and she was afraid that if she didn't use this doctor, that she wouldn't have a doctor to deliver her baby. And so she was just saying she couldn't ask this question because out of fear, that she wouldn't have anybody else. She felt like, this is the care that's given to me, so this is the care that I have to have. And so sometimes, depending on the type of insurance patients have, they are afraid to speak up because they feel like, this is what I'm getting, so I can't get any better. So when the care is bad, when the communication is bad,
Hmm.
when the attentiveness is bad, when the energy is bad, or that just a relationship, they're afraid to switch because they feel like, I don't have any other choice. And so I really tell moms, you can switch providers. If the energy is not there, if you're not
Hmm.
vibing with, that's a real thing. If you don't feel like you have a relationship with a provider that you can have discourse and dialogue that best serves you, you need to get another doctor,
Hmm.
right? Listen to your body. Are you feeling something? If someone says you're wrong, don't listen to them. You feel like something is wrong. You need to advocate for yourself. Doc, I really feel like something is wrong. Do you think you can see me, or can we evaluate this thing?
Hmm.
Right. And so it's really, in my line of work, I try to make sure that in different avenues, I'm making sure that mom can advocate for herself, right? Which is why I do
Hmm.
the podcast, so the events, I try to make sure, mom, we're going over this. Every mom who I see, I give them a book. And in the book, the what to expect next guide, we talk over everything. Who's going to be helping you? These are the things to watch out for.
Hmm.
How's your bleeding? So mom really needs to be her best advocate. After mom, it's everybody in her circle, whoever's going to be in the home. Then
Hmm.
there's a community at large. Everybody needs to know what to look out for. If there's signs and symptoms of postpartum depression, everybody needs to look out for mom. And then, at the end of the day, if the government, there's just obviously some things that we cannot change where people live. We cannot change, people's health plans. There's things that are beyond us, right? Talk about social determinants of health. These are
Hmm.
things that, it requires buy-in from government,
Hmm.
politicians to be able to work on changing these things. And so those may be the slower things that take to change, but there's things on an individual and community level that we have to do because
Hmm.
we know government's going to be slow in doing the changes that need to happen.
Right. I would agree with you on the education piece. It's so huge. I find when I'm going over discharge instructions with people, especially if they're first time moms, like there is a lengthy list of things that were like, you should call your doctor about this.
Hmm.
And they are often just like surprised at the amount of things that could happen. Like,
Hmm.
especially it's just looked upon childbirth, oh, you had a baby. So
Hmm.
normal. And it is normal. But it's also like a huge deal with your body, you know? People don't realize that pregnancy and childbirth is like a giant assault on a woman's body. It's there's your body is just basically taken over and doing a whole other thing.
Absolutely.
And then has to recover from that thing.
Hmm.
And so it's just really tough. And I would agree with you having just more education in general, just so society like widespread knows more about anything postpartum, like what to look out for mental health wise, but also physically, because especially some men are just like, and it's not their fault, it's not, those things don't happen with their bodies, and maybe they didn't pay attention in sex ed, and they're like, they would have no idea what's going on, like what's too much blood, or what happens and how to help their wife if this is going on, And so we can do things as individuals and, in our communities, like immediately. And then, of course, yes, the governmental processes are slower. Pay attention to who you vote for and, try to make change in your own personal community. And education is huge. I would
Yeah.
agree because just knowing what to look out for just on a widespread level is big because if mom knows, that's one thing, but
Mhm.
mom is really focused on that baby, so she's not really exactly paying attention to herself maybe until it's too late.
Absolutely.
So, yeah, I would agree that having more widespread education so that people know because they need to look out for mom too because she's just enveloped in this baby. So she is not going to notice something with herself maybe right away.
Absolutely. I think mom's brain is taken over by
Oh
hormones.
yeah. Yeah. Yeah,
By
and then you
hormones
add the no sleep, it's
with no
just
sleep.
it's terrible. It's a whole thing. Yeah, I agree. It's
And the downplaying of symptoms, right? Like, oh, I have this headache, but like I haven't slept, I haven't eaten,
right.
haven't drank.
Mhm. Mhm.
That's why, oh, my legs are swelling because I'm just walking around a lot.
I know, I know. Or I'm puffy because I ate a lot of salt and it's like,
So,
can you please call the doctor? You might have high blood pressure.
Yeah.
Yeah, I agree. Yeah, I remember my patient the other day goes, to her husband. She goes, I'm going to need you to listen to this because I don't remember things right now.
Right.
I was like, I know, I get it.
Right.
But you work with mothers to help them maintain their own health while they're caring for their babies, which is great. And what are some common obstacles or misconceptions that mothers face in prioritizing their own health postpartum? And how can healthcare providers encourage a mindset of self-care when moms are so dedicated to those babies?
Yeah, I think there's a lot of judgment out there that moms face, whether it's from other moms, whether it's from people without children, whether it's from family members. There's this like judgment, right? Because our moms probably were superheroes, are superheroes, right? They were managing babies, multiple babies, going to work, caring for the home, keeping a clean house. So there's a lot of pressures that depending on which culture mom comes from or how mom was raised. And so sometimes she feels like she has to do it all. And so they want to be there for the other kid. They want to clean the house. They want to cook dinner. And they also feel like they have to do these things.
Mhm.
And so they end up literally driving themselves into burnout and fatigue because of these expectations that they have put on themselves and that society has put on themselves. And so I would say that's really one big thing where it's like I have to tell moms constantly like, slow down, like rest. You just
Yeah.
birthed a baby or you just had a C-section. Just, relax, take time, have people cater to your needs.
Hmm.
You are the one who needs to, but it's like even in their mind, they're like, I need to take care of my kid. I need to
Hmm.
take care of my husband. I need to take care of my home. It's like this, like I need to care for everybody else. And so it just takes away from them. And so the biggest thing that when I come around is to make sure, how are you caring for yourself? What did
Hmm.
you do for yourself? And sometimes, doing for yourself is sleep, and doing for yourself is eating, doing for yourself is taking a walk, doing for yourself is resting. And so I would say that is what I probably face the most is just moms have incredible expectations.
Hmm.
And sometimes it's just not reasonable. But we all go through it. I'm
Right.
sitting here after the fact of the matter and I'm having this conversation saying this.
Yeah.
But when I was going through it, I was trying to do everything, trying to maintain, the home. I failed miserably at
Oh, yeah.
it, and and may not have had the supportive partner to say, how can I
Hmm.
help? And so I ended up feeling inadequate because I couldn't maintain everything else. And my, in-laws were like, she can't maintain everything else. So then it's like, it's this whole cycle. They have to have people in their corner
Hmm.
understand that it's not all going to be it's on you. It's
Right.
for everybody to help.
Right. And like, you're on, say you work and you're on maternity leave and you're like, I'm not working, so I should have all this time, right?
Hmm.
Nuh-uh, you're recovering from having a baby. Do you know how much slower you move simply because you're recovering from having a baby? Like you are just like, and you won't even realize it. You're just not capable of the speed and like agility that you once were. You will
Yep,
be again, but just
yep,
not right now. So you can't rush through these things. And also, I mean, the babies, they need to eat every 3 hours. So that 3 hours goes super quick.
right.
And it's just like, oh my God, they need to eat again. And it's like a lot to keep up with, and so I agree, like asking for help. And I always tell my patients when they're going home, I'm like, okay, so somebody wants to come over to your house and see your baby, that's great. Here's the
Hmm.
deal, you need to barter.
Yep.
I was like, barter for your baby. I was like, because these people, they love you and they want to help you. They just really don't know how. That's kind of the story.
That's it.
They don't know how to help you. And so give them constructive ways to help you. It's like it actually helps them and it makes them feel useful. So tell them, yeah, I would love it if you wanted to come visit the baby. Can you please bring dinner?
Hmm.
Or would you do the dishwasher while you're here? Or can you hold the baby while I take a nap? Or can you hold the baby while I take a shower? Or can you do some laundry? Like anything,
Yep.
like anything to help. And people look at me like, that's crazy. Like you're gonna ask like just your friend, like a neighbor
Yes.
to do your
Yes.
laundry. And I'm like, yeah, you know, and you know why you can do that? Because your neighbor has
Hmm.
likely been through this themselves
They
And
get
they get it. Like it's a universal human type thing.
yes.
Like everybody understands like going through the childbirth process and like you're exhausted and
Yes.
your body hurts and the partner is exhausted and doesn't
Yes.
know what to do to
Doesn't know
necessarily support the
what to
person and but they want to and they love
Yeah.
them. And it's just a stressful time and you're tired and yeah, so it's a universal human experience. You know, if you've had a child, people understand. It doesn't matter if it's your pastor or your sister. You
Yep.
know, you
They
can
get
ask anybody to fold your laundry. So, yeah, I would agree with you on that. Asking for help is big.
it.
It's and people, yeah, there's so much pressure on moms like to be perfect, you know, why and also why haven't you lost the weight yet? What's going on with that?
Oh my
And
God.
you know, that's a whole other conversation. And so, like, the stress on a mom to be perfect, on women in our society to be perfect, and to be able to do all the things. And especially, I know, like, some cultures emphasize, you know, that role as a like homemaker and wife and mother more. And like, why can't, what is wrong with you? You know,
Yeah.
like, what, you can't get your stuff together and handle all this stuff? That's weird. You know, like, that's are you okay? You know, like,
Right.
you're defective kind of a thing. And it's like, no, I just popped out a whole human and I am tired. This hurts, you know, whatever it is. And yes, we need to have more patience with our moms. And also there's some opposite cultures who it's beautiful and they're like, no, you do nothing.
Oh my gosh, I want to go there. I
You
want to
sit
do
here.
that.
I know.
There are
And
some. There's a lot. Yeah, there's a
yeah.
lot. Mom, I've seen even, I mean, I had the privilege to go home. My family's in Zambia,
Mm,
and my cousin had a baby, and she basically, was there at home, and there was mom. She just moved back in with her, to be
yeah.
with the mom, and then mom just
Amazing.
helped take care of the baby until she got to a point where she was strong enough to be able to do it on her
Amazing. And that's
own.
just normal. I
Hmm.
know. I know I take care of a lot of Somali women, and that's the same thing. And like as Americans, perspective can be like, oh, she's so lazy. Oh my God, no, shut up.
Hmm.
You know, yes, she needs to get up and move for certain reasons, but she also doesn't need to do everything.
Exactly.
Yeah.
Exactly.
I'm like, oh, that's amazing. You guys are doing a good job on that.
Right, right, exactly.
Yes. I appreciate you so much. I know you have to go and pick up your child, so I will let you go. But I appreciate you so much for coming on the show, and I appreciate your expertise and what you do with your individualized care. That's huge. So
Mm.
thank you so much.
Thank you so much for having me.
Yes, you're welcome. You have a good afternoon.
All right,
Bye
bye.
bye. Mommy Mentor audience, that was Dr. Phindile Chowa, and she is a obstetrician in Atlanta, and she provides wonderful individualized care in the fourth trimester, as we discussed. And I am such a fan of fourth trimester focused care because no one even knows there is a fourth trimester really, and no one really thinks about mom much after the baby is born. Think about when you go and visit someone who had a baby, who are you more interested in, the mom or the baby? And so that is just something in our society that needs to change a little bit, and we would have much better outcomes for moms in this country if we had more in general education around the fourth trimester and what to look out for moms while they are learning how to be moms and they are recovering from childbirth and super focused on a new baby where they may not notice something themselves. If you are wanting to go to Dr. Chawa's Instagram, you sure can do that. There's two Instagrams. She has a one for her clinic. It's EMCare2U, so EMCARE2U. She also has a personal Instagram at Dr. Chawa. DRCHOWA. She has a Facebook page for the clinic. It is EMCare2U, this EMCARE and the number 2 and U. And she has a Facebook group, and that is Beyond the Fourth Trimester Postpartum Support. So you can look that up. And please, if you are so intrigued, or you know someone who's just given birth, or you have given birth yourself, please look at things that you should be paying attention for in the fourth trimester and things that you could perhaps out for in your partner or your sister or a friend. because women need as much support as they possibly can get in the fourth trimester while they're recovering from having a child. In some cases, they're recovering from having a major surgery, which is a cesarean section. Not a lot of people consider that a major surgery, but if you think about it, a woman is cut open and her organs are moved around and a baby is removed from her belly and her uterus is sewn back up, and then several layers of tissue. Oh, wait, then we got to put her organs back in her body, and then several layers of tissue are sewn up, and she's stapled shut. Then she's supposed to just go about life normally in about 12 hours. So, yes, and women who labored and pushed out a baby, that is a big giant deal too, because it is like it's the biggest workout of your life. So we need to take care of our moms better. And I implore you to educate yourselves on the fourth trimester. And Dr. Chawa has a book. It is called What to Expect Next. So I encourage you to check that out. In addition, please check out my website, mommymentorpodcast.com. Please find me on Instagram or TikTok at My Mommy Mentor. You can also find my YouTube channel at My Mommy Mentor. Please check that out and send me an email or a message. I would love to have more audience engagement and talk with you guys. And please let me know if there's anything you would like me to cover in another episode. Have a great whatever time of day you're listening. And as always, safe parenting out there.